Lock in. We're locking in. Locking in. I'm locked in. Hi guys, this week I wanted to do another news dive, but I really struggled to find an article that I liked for YouTube. Then I remembered an article that I'd read because of my own self-interest, and I thought I might as well use it for this week's video. The way this video is going to work is I'm going to go into what the article spoke about, and then I'm going to talk about some further research that I've done on the topic and give you my thoughts. And I would like you to give me your thoughts in the comments. I really enjoy when we have discussions on social media and everyone sort of throws their opinion around. And so I want to know what you think of this story. I read an ABC article on a South Australian oncology nurse who was charged and suspended for 3 months after stealing medication. The theft itself happened in early 2021, where she stole medication from the dispensing cabinet and made false entries on 2 medications, hydromorphine and pregabalin. At the South Australian Civil and Administrative Tribunal hearing, they said that she had stolen 24 medications, including hydromorphine and fentanyl, which are opioids, gabapentin and pregabalin, which are nerve pain medications, and citalopram, which is an SSRI or an antidepressant. The tribunal stated that her behaviour amounted to professional misconduct, and her addiction meant that she reflected a lack of qualities essential for the practice of nursing, including the exercise of judgment to uphold the broad principles of public health and safety. The nurse said that in her 20s she developed a medical condition, and during that time did not seek any medical or psychological help. She has since received help for her addiction and was embarrassed and ashamed of her actions and is genuinely remorseful. She was suspended from working as a nurse in Feb 2021 and was subjected to strict undertakings where she was only allowed to complete administrative duties.
Hello, IT. Have you tried turning it off and on again?
After her 3-month suspension, she will be allowed to go back to her nursing duties, but under tight restrictions, and this includes completing regular drug screens, restricted access to medications, and she cannot apply to be the only registered health practitioner at any location. I found this story very intriguing because of my own knowledge around nursing rules and regulations. Both fentanyl and hydromorphine are considered Schedule 8 drugs, and citalopram is considered a Schedule 4 drug. This means that there are tight regulations that nurses must abide by when they dispense and administer these medications to patients. Both Schedule 4 and Schedule 8 drugs must be locked in a safe or a safe-like box and put in a room that only authorized personnel can enter. Dispensing and administrating these drugs must be done with 2 nurses, and they have to document everything. I'm talking the name and patient number of the patient that's receiving the medication. You have to document the amount of tablets, including the dosage of the medication you're taking out, and document that. Count the tablets again after you've taken medication out to then record that number and put everything back in the safe and lock it up. The nurses have to sign it to make it legally binding. When administrating the medication, the second nurse has to come with you to visit your patient, then have to double check the name and the patient number again to confirm that you're giving it to the right patient. Even if you're not administrating or dispensing these medications, they still have to be counted after every shift turnover. So that means that 2 nurses from the different shifts will go into the med room and they will count every single tablet of every single medication in those safes to make sure that the numbers line up with what has been documented previously. So it takes a bit of effort and is legally binding when you dispense these medications. And you can get into a lot of trouble for stealing these medications and making false entries to try and save your own ass. What I was curious about more than anything was the rates of nurses that actually steal medication and those that actually steal controlled substances specifically. So I looked it up. The first thing I saw was a Sydney Morning Herald article from 2010, And they found that addictive drugs were stolen or went missing in 20% of New South Wales' 220 public hospitals. North Shore Hospital specifically had meds go missing every month. This included morphine, fentanyl, and temazepam. And we know that morphine and fent are Schedule 8 drugs, while temazepam is a Schedule 4 drug, just like citalopram. The article then went into multiple examples of nurses being charged outside of this investigation, and they said that one nurse risked a patient's life by substituting their pain medication for a vitamin tablet. This to me is just so crazy, but the study itself is over 10 years old, so I also wanted to look into something more recent and more local to me. I found a research paper from the Medical Journal of Australia that was completed in 2022, and they investigated computer data from 2019 from the Electronic Pharmacy Drug Management System and the Medication Administration data for 20 regularly used medications across 4 public hospitals in Melbourne. They found that almost 1/5 of medications supplied to medical wards, surgical wards, and ED departments were not administered to their patients, and this equates to 19.2%. They didn't investigate the reasons behind the 19.2 discrepancy rate, but did say that it was partially explained by theft, typically for self-treatment. Other possible reasons including failure to document verbal orders, temporary unavailability of the med record system, undocumented preparation, administration errors, waste or spillage, stock recalls, or medication expiry. Although I find it interesting that there is such a high discrepancy rate, I do take it with a grain of salt, and I'll tell you why. When I was working as a nurse, it was very common for us to keep certain medications on us for on the go. I specifically did this with Panadol, but I would always forget to put it back at the end of my shift. This meant that I would accidentally take it home, and I would usually just throw it in the stash of other Panadols that I've accidentally collected from work, and I guess I would use it for self-treatment, but it was never intentional. I only ever did this with Panadol. I wouldn't intentionally put any other medications in my pocket, and I certainly wouldn't have taken medications that were locked in a safe. I did accidentally take home an insulin once, but that went back the next day, and it certainly was an unintentional thing. It's just crazy to me to think the amount of nurses that actually steal these medications, especially when you have to have another nurse with you. How do you hide that? That is just insane. But we also have to remember that the reason why these drugs are locked up is because they're highly addictive drugs. And I can see nurses that are already struggling with addictions facing these drugs multiple times a shift, getting that itch and needing to suppress their addiction. As someone who has suffered with addiction, I really know how hard it can be and the toll that it can physically put on your body. So it makes sense that it does happen. And I'm never going to shame anyone for having an addiction, as it is a really, really hard thing to struggle through and pull yourself out of. Let me know what you think about this. Do you think that nurses stealing medication is common, or do you think that it's overplayed in the media, like in the Sydney Morning Herald article, where they spoke about the investigation and then just went bam, 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 bam. All the nurses that have stolen meds, ugh. And if you're a nurse, tell me if you've ever accidentally taken anything home from a shift. I know on multiple occasions I've almost taken the MedSafe keys home. At one instance, I actually came back with them and was like, sorry. And then the nurses on the shift were like, oh, we didn't even notice they were gone. So it happens so constantly. We are bombarded with so much information, and there's always so much in our minds that we really do just forget what we have in our pockets. And it's not good all the time, but sometimes it's okay.
Sometimes may be good, sometimes may be shit.
Thank you for watching this video. Please give it a like and subscribe if you haven't already, and I will catch you guys next week.